Hi, so my question is actually about your opinion on healthcare, because I know that you believe that privatization of healthcare is the most effective means to solve the problems that we have. Yet besides thought experiments, I really haven't seen any evidence for that. For me, when you look at the facts, you look at more socialized programs such as Canada, they spend 10% of their GDP on healthcare, and yet their life expectancy is in the low to mid 80s. You look at the UK, and they spend 8.8% of their GDP on it, and the life expectancy is also in the 80s. But then you look at the United States, we have a more privatized system. We spend 15.4% of our GDP on it, and yet our life expectancy is lower. So my question is, why do you, my question is basically, if you look at all that, what it tells me is socialization of healthcare covers more people, makes life expectancy longer, and it's just more effective all around. So do you have any evidence or examples where privatization has actually increased healthcare?
Okay, so the truth is that we haven't actually seen a move from a socialized medicine system to a privatized system. So it'd be hard to find an example where moving from one of those examples to a privatized system works. And we haven't really seen even a system where we move from privatization to universal health care in the sense that the system has never been deregulated. I mean, my basic premise is that what we have now is almost the worst system. We have a mixed system, which has driven up costs because of subsidizations from Medicare and Medicaid, and has also driven up costs because of regulation, and then it's still privatized, so doctors are still charging a lot of money. The best example that I can use is a small-scale example because it doesn't exist in large scale. By the way, we can talk about problems in socialized medicine systems. We can talk about the fact that there is rationing of healthcare that does occur in places like Canada and Britain in a way it doesn't with regard to surgery, particularly in the United States. We can talk about cancer survival rates in the United States, which are better than cancer survival rates in socialized medicine countries. We can talk about the fact that it's not you really shouldn't statistically compare life expectancy between Canada and Britain and the United States because the populations are incredibly different.